Hello, and welcome to Brookwood Baptist Health. We are so happy that you have chosen to be part of our team. We know you could have chosen many other places to work, but we are very grateful that you chose to be here. My name is Kathy Boswell, and on behalf of Tenet Healthcare, I'm pleased to provide you with an overview of the benefits program. We're very proud to be able to offer a competitive and comprehensive benefits program, one that we believe provides valuable financial protection to our most important asset, and that is our employees. I will be covering a lot of information during this session, and to be honest with you, I know that it will feel overwhelming. But let me just give you a couple of pieces of information to hopefully ease and sort of settle you. One is that you will not have to make a decision today. You actually have 30 days after today to make decisions and enroll in the benefits. The second thing is that after today, you will be able to access all of this information that I'm actually reviewing with you on the Brookwood Baptist Health intranet site, as well as mytenet.com. I would also encourage you that if you have any questions as you are going through this overview, just be sure to jot them down, and you can always contact your human resource representative at a later point, or either you will have access to some phone numbers and resources at the end of the presentation of people that you might be able to contact to answer questions that you might have. So let's start by talking about who's eligible for benefits. We'll also review when your coverage actually begins. Let's take a look at who's eligible for benefits. You are eligible for benefits based on your employee status and scheduled hours. Full-time employees are scheduled for 30 or more hours per week. Part-time benefits eligible employees are scheduled between 24 and 29 hours per week. You might notice the asterisks on the chart. If you elect coverage for yourself under any of the benefits with an asterisk, then you will also be able to enroll your eligible dependents under any of these benefits as well. Your eligible dependents include your legal or common law spouse or your domestic partner regardless of gender. Eligible children include your natural born, adopted, step, or foster children for whom you are a legal guardian. In addition, if you have a child who is or becomes disabled before age 26, you may continue covering your child after age 26. It's important to note, if you enroll any dependents for benefits, Tenet will request proof of eligibility for all dependents. Please be on the lookout for the request for proof documents if you enroll any dependents. Now, key information that you do need to remember. You have 31 days starting with your date of hire to enroll for benefits. If you do not enroll in benefits by the day 31 deadline, the next opportunity for you to enroll will be the next calendar year unless you have what we call a qualified life event. We'll talk more about what a qualified life event is later in this presentation. Your benefits are effective on the 31st day of employment. So now let's take a look at the 4 medical plans that will be available to you. All of them are administered by Blue Cross and Blue Shield of Texas. Let's start with the Platinum Plan in the upper left corner. This is an exclusive provider organization, also called an EPO. This plan offers mostly fixed copays for services, but also comes with the highest premium cost of any of the 4 plans. In addition, the Platinum Plan has no out-of-network benefits, which means that if you select this plan, you'll need to see physicians and providers in either the Tenet network or the Blue Cross Blue Shield network to access services. Take a look at the Gold Plan in the upper right corner. The Gold Plan is a preferred provider organization called a PPO plan, and it includes a health reimbursement account funded by Tenet to help you cover out-of-pocket expenses. The next plan in the bottom left corner, the Silver Plan, is a high deductible health plan and comes with a health savings account which allows you to save dollars tax-free to pay either current or future qualifying medical expenses and roll any savings over annually. We'll talk more about how the health reimbursement account and health savings account works in just a few moments. The last plan in the bottom right corner is the bronze plan. It is also a high deductible health plan and carries with it the highest deductible, but also has the lowest paycheck cost of any of the plans. There are three networks in all of the medical plans. We first have the Tenet network, we then have the in-network, and we have the out-of-network. Here in Alabama, the Tenet network consists of the Brookwood Baptist Physician Alliance physicians and our 5 hospitals, which are Brookwood, Citizens, Princeton, Shelby, and Walker. There are Tenet physicians and hospitals in other states as well. When we refer to the in-network, we mean the Blue Cross and Blue Shield network. Here in Alabama, it's referred to as the Blue Cross and Blue Shield of Alabama, but across the nation, there are also other Blue Cross and Blue Shield networks. Thirdly, when we talk about the out-of-network, this means that we're referring to any provider or hospital that is not in either the Tenet or the Blue Cross and Blue Shield network. So as you think about these plans and which medical plan option is the right one for you and for your family, here are some things to consider. First, your out-of-pocket cost will depend on the plan you select, the services you receive, and the providers that you use. Some services will require you to meet an annual deductible based on the plan you choose. After you've met this deductible, you'll pay co-insurance for many services, which is a percentage of the total cost, with the rest of that cost being paid by the plan. Some of the plans require co-pays for some services, which is a set dollar cost for the services. And as we'll see when we look at the plans individually, all of the plans do offer the same basic coverages. One, prescription drug is included, and then secondly, all the plans include preventive care services and some screenings are covered at 100%. Here's a side-by-side look at your plan options for 2018. They each differ by the amount of copays, coinsurance, deductibles, and out-of-pocket maximums that are associated with each plan, as well as how they cover a variety of services. The premiums for each of these plans are also different. You can find pricing details on the rate sheet posted on the Brookwood Baptist Health intranet site. As you can see, the Platinum Plan is the only one that offers copays for doctor's office visits. Also remember, the Platinum Plan doesn't offer any out-of-network benefits. The Gold Plan is the only plan that offers a health reimbursement account, which is company-funded money to help you pay for out-of-pocket expenses. The Silver Plan is the only one that offers a health savings account, which is an employee-funded account that is used to pay for out-of-pocket expenses. Whenever you or your dependents use the Tenet network for inpatient hospitalization or outpatient procedures, the facility charges are waived. This benefit is not given through Blue Cross Blue Shield of Texas. It is given by our business office that handles patient billing. Please notice the asterisks next to the facility charges on this screen, as well as in the benefits guide. The asterisk is referring you to the Tenet policy that waives the facility charges. To read about this benefit, go to etenet.com in the Policies and Procedures section and search on the keywords waivers of copays and coinsurance. Now, one thing I will add here is there is a $100 copay for the emergency room in all 4 plans. Unless you are admitted to the hospital, the $100 is not waived, even for Tenet facilities. However, just like any inpatient and outpatient care, the 10% of emergency room facility charges are waived for Tenet emergency rooms. Please go to mytenet.com to review the details about the medical plans as well as all the benefits. When you elect your medical plan, You have prescription drug coverage along with it, no matter what plan you choose. Prescription drug coverage is administered by CVS Caremark, which has an extensive network of pharmacies. Generics in particular are a significantly lower cost option, and generics generally work just as well as the brand name drugs they replace. If you choose a brand name when a generic is available, you may pay an additional amount on top of the copay or coinsurance. If you are on a maintenance prescription drugs, those must be filled through either the CVS mail order drug program, a CVS Caremark retail pharmacy, or a Brookwood Baptist Health Pharmacy. There is a Brookwood Baptist Health Pharmacy located on both the Brookwood Hospital and the Princeton Hospital campus. Both of the BBH pharmacies will mail your prescriptions to you for no extra charge. You may also pick up your prescriptions in person. For your convenience, you can also set up auto refill. Now, for specialty medications, those include drugs that are expensive, have limited access, or have compliance requirements. Those are just a few of the reasons why a drug would be categorized as specialty. If you need specialty drugs, you may fill them once at any in-network pharmacy, but after that, refills must be made through either the CVS mail order service or one of the Brookwood Baptist Health pharmacies. The prescription benefits are the same in each medical plan except the Silver plan. In the Silver plan, you must meet your annual medical plan deductible before prescription benefits are paid. Your copays and coinsurance for prescription drug coverage depend on whether the drug is generic or whether that drug is in the CVS Caremark formulary or is a non-formulary drug. To see the list of formulary drugs, go to caremark.com. Now I'll go over 3 different types of healthcare accounts. Each of these accounts will work a bit differently. First, let's talk about the accounts associated with the specific medical plans. The Silver Plan option comes with a health savings account called an HSA, which is an opportunity to save money to pay for your medical expenses. Your contributions to your HSA come out of your paycheck on a pre-tax basis, and your account can earn income which is tax-free. And when you make withdrawals from the account to pay medical claims, these dollars come out tax-free. Any balance left in your account at the end of the year rolls over to the next year, and the account belongs to you, so that if you go or leave Tenet, it goes with you. For 2018, you can contribute as much as $3,450 to an HSA if you elect individual coverage, and $6,900 if you elect any other coverage level, spouse, family, or child. Another option, the Gold Plan, has an accompanying health reimbursement account called an HRA. It is funded by Tenet annually in the amount of $300 if you elect individual coverage and $600 for any other coverage level, family, spouse, or child. The contribution is prorated if your coverage doesn't begin on January 1. Those funds are available the first day your coverage is in effect to pay for any of your qualified health expenses, including expenses for medical, dental, vision, and prescription. To use your HRA funds, you'll use a debit card or submit for reimbursement until the funds in the account are exhausted. If you have unused funds in the account at the end of the year, the balance will roll over as long as you continue to elect the same plan. You can't make personal contributions from your paycheck to the HRA, but you can combine it with a health care flexible spending account, which we'll talk about next. So you could have 2 sources of funds to cover some of your health expenses. Now, let's talk about the 2 flexible spending accounts you are offered. The Healthcare Flexible Spending Account is available to you as long as you aren't also enrolled in the Silver Plan that offers a health savings account. You can contribute up to $2,600 to the Healthcare Flexible Spending Account for 2018 and may use those funds to pay your medical and other eligible expenses with pre-tax dollars. Eligible expenses include any out-of-pocket medical expenses as well as any out-of-pocket expenses for dental and vision. One important detail to remember about healthcare flexible spending accounts is that you must use all of the funds you contribute by the end of the calendar year. So any funds you contribute this year would have to be spent on claims incurred by December 31st. It's called use it or lose it. To use your healthcare spending account funds, you'll pay for expenses with a debit card. If you are also in the Gold plan, your HRA funds will be on the same debit card and your healthcare flexible spending account funds will be used first. You forfeit any funds that are left in the account unspent for the calendar year, so it's important to carefully estimate your expected expenses and not contribute more than you think you'll need. In addition to the healthcare flexible spending account, there is another flexible spending account option called a dependent care flexible spending account. This account allows you to set aside money from your paycheck up to $5,000 a year on a pre-tax basis and can be used for children under age 13 or other qualified dependents unable to care for themselves. Some examples how you can use your dependent care flexible spending account funds are nursery schools, child care centers, or individuals who care for preschool children, before school or after school care for children from kindergarten through age 12, or for a disabled dependent of any age, providers outside the home who care for a disabled dependent, or summer day camps programs in lieu of daycare. For a complete list of eligible expenses, you can visit the IRS website at www.irs.gov. Now let's take a quick look at the accounts and how they all work together to give you the bigger picture. The health savings account goes with the Silver plan and is 100% employee funded. The health reimbursement account goes with the Gold plan and is 100% company funded. Unused funds in both accounts roll over at the end of the calendar year. We'll stop here just for a moment to just see if you have any questions. Okay, so now that we've covered the medical and those associated spending or savings account, let's take a look at Tenet's dental, vision, life insurance, and disability offerings. We offer you the choice of two plans for dental, which are administered by Delta Dental. The comprehensive plan offers preventive, basic, major, and orthodontic services, and the preventive plan also covers preventive services. Even though you are not required to use dentists in the Delta Dental network, you'll save money if you do. To see the network dentist, go to Delta Dental website and search on the Premium Network. To review the details of the dental plans, go to mytenet.com. Let's look at Tenet's Vision Plan. This plan is administered by VSP and it covers eye exams, lenses, and frames, and also offers discounts on laser eye surgery. You can visit an in-network or an out-of-network provider, but you'll save money if you see an in-network VSP provider. Plus, there are no claim forms to file. If you use an out-of-network provider, you have to pay at the time of service and then submit a claim form to VSP to be reimbursed. Now, let's take a moment to talk about life insurance. Full-time and part-time one employees receive a basic employee life insurance coverage that provides your beneficiaries a payment in the event of your death. Coverage is equal to 1 times your annual base pay up to $50,000. Tenet pays the entire cost of this benefit. Basic employee accidental death and dismemberment coverage, called AD&D, provides a payment to your beneficiaries in the event of your accidental death or payment to you if an accident results in a serious injury, like the loss of a limb. Again, coverage is equal to 1 times your annual base pay up to $50,000, and Tenet pays the entire cost of this benefit. If you would like more coverage, you may purchase supplemental life and or AD&D insurance for yourself, your child, or your spouse. but you must have supplemental coverage for yourself in order to buy for a spouse or child as well. Full-time and part-time one employees are also eligible to purchase short-term and long-term disability insurance. You may purchase disability insurance that provides income if you become temporarily or permanently disabled and are unable to work, including extended illness, injuries, or the birth of a child. There are two plans: the Standard Plan, which pays 50% of your base earnings, and the Standard Plus Plan, which pays 60% of your base earnings. Details about the two options are on mytenet.com. Medical, dental, vision, life, and disability coverage are just part of what Tenet offers to our valued employees. Tenet offers a wide array of other benefits like paid time off, the Employee Assistance Program, and accident insurance, to name a few. We'll briefly go over those next. Let's start with the time off plans. Paid time off, which is also called PTO, is for benefit eligible employees up to manager level. PTO includes vacation, holidays, sick days, and personal days. PTO begins accruing on the 31st day of employment. Unused PTO carries over to the next year up to a maximum of 1.5 times your annual PTO accrual. This PTO chart is for employees who are scheduled to work 40 hours per week. If you're scheduled to work less than 40 hours per week, then your PTO will be prorated accordingly. Employees who are director level and above get management time off, also called MTO, instead of PTO. For details on MTO, please go to mytenet.com to read the MTO policy. The PTO policy is also on mytenet.com as well. We all face challenges from time to time, and that's why we offer the Employee Assistance Program called an EAP. It's a free, confidential professional counseling service to help you out when you're dealing with a difficult issue. Our EAP is offered through Guidance Resources, which has several options to seek help in the way that is most convenient for you. We have an online and over-the-phone 24-hour a day, 7-day a week without any limits. Or if you prefer to talk to someone in person, that's an option too. You can get up to 5 free in-person visits per issue per year. To learn more, visit www.guidanceresources.com or call 844-416-1158. Tenet also gives you several additional options to help prepare for the unexpected. The following 3 plans are administered by Unum. The first plan, accident insurance, pays you directly based on the injury and treatment you receive, regardless of other insurance you may have. Some examples of services covered under this insurance are ambulance and emergency room, accidental common injuries, physical therapy, follow-up doctor visits, prosthetic devices, etc. You can take the coverage with you if you leave the company for any reason, and you can cover yourself and your eligible dependents. Secondly, critical illness insurance can supplement your medical or disability insurance. It pays a lump sum directly to you at the first diagnosis of a covered condition like a heart attack, stroke, or cancer. Pre-existing conditions do not apply. However, certain limitations may apply based on the particular illness. You can purchase coverage for yourself and your spouse. Dependent children are automatically covered at 25% of your benefit amount. Medical coverage is required in order to enroll in critical illness insurance. Thirdly, long-term care insurance can help pay for care at an assisted living or long-term care facility or for home care services for you, your spouse, or your parents. The plan also provides benefits in the event of severe cognitive impairment from an illness such as Alzheimer's disease. This plan pays benefits when a covered individual is unable to function independently because of a covered disability or chronic illness. For more information or to enroll, contact Unum at www.unum.com or call 888-852-2232. If you or a dependent has a chronic medical condition such as asthma, diabetes, or lower back pain, the free chronic care management program pairs you with a nurse to help coordinate care with your doctor. Here are some of the chronic conditions that can be addressed in the program: asthma, chronic obstructive pulmonary disease, coronary artery disease, depression, alcohol abuse, diabetes, heart failure, or lower back pain. Find out more about the program by calling 844-368-8115. There's also an added benefits program, and that is exactly what it sounds like. Additional coverage and help that can protect the things that mean the most to you while also helping you save money. You can elect these benefits anytime through the year. Options include pet insurance, auto and home, identity theft protection, legal services, student loan refinancing, and daycare discounts. Just go to the added benefits link on mytenet.com to enroll or learn more about these options. In appreciation for all you do, Tenet offers a no-cost employee discount program to help you save on the things you want. Things like cell phones, computers, travel, restaurants, cars, and more. With every Tenet Perks purchase, you earn WOW points that you can redeem at any merchant in the program to get free items or deeper discounts. You can learn more by finding the Tenet Perks link on mytenet.com and start shopping. Tenet offers a 401k retirement savings plan to help you save for your future. And the good news is you can enroll or change your elections any time of the year. The 401k plan is open to all Tenet employees beginning on the 31st day of employment. You contribute on a pre-tax basis through paycheck deductions. Tenet will match 50 cents for every before-tax dollar you contribute, up to 6% of your eligible pay. Matching contributions are fully vested after 5 years of employment with Tenet. Your own contributions as well as any earnings from your contributions are always 100% vested. The plan is administered by Fidelity, and there are two ways to enroll or get more details. Visit www.401k.com or call Fidelity at 800-372-4015. Tenet also offers an employee stock purchase plan called ESPP. Employees who work at least 20 hours per week and have been employed for 30 days or more are eligible to participate. Eligible employees may purchase Tenet common stock at a discounted rate of 5% through paycheck deductions. You may purchase from 1% to 10% of your annual base pay up to an annual maximum of $25,000. It's important to note you must hold your shares for at least 1 year before you sell them. Enrollment for the ESPP is held on a quarterly basis. There are two ways to enroll. Log into www.netbenefits.com or call a Fidelity Investment representative at 800-544-9354. There are other benefits too, such as the adoption benefit, fitness center discounts, and tuition reimbursement. Details about these benefits are on the intranet under Benefits. Here is an easy way to keep all your benefit contacts organized. Use MyBenefitsContacts.com, our digital contact card designed to put all of the phone numbers and websites you need at your fingertips. All of your benefit contacts are in one place on MyBenefitsContacts.com. No username or password is needed. Just save it as a favorite on your phone and you'll always be one click away from the answers that you need. Okay, it's time to see what you need to know to enroll for your benefits. Okay, so how should you prepare to enroll for your benefits? First, review your medical options and take advantage of the resources you have available to you, particularly the benefits guide, which provides lots of details on the various options. Secondly, make sure you have all of the details you need on any dependents you are enrolling, such as their date of birth and social security number. And then third, when you're ready, head to mytenet.com to enroll. Remember, your deadline to enroll is 31 days from your date of hire, which is the date you became eligible for benefits. Now that you have your username and password, you're ready to log in to mytenet.com. The login screen will look like this. If you forgot your password and username, you can click on the Forgot Username or Password link or log into eTenant and click the My Tenant icon. Once you log in, click on My Benefits, then select Enrolling Changing Benefits. Then select Benefits Enrollment website. Next, click the Enroll in Your Benefits link. If enrolling your dependents in any of your plans, be sure to complete the dependent information section completely, including providing your dependents' Social Security numbers. When finished, click the Submit button to record your elections. Finally, be sure to print the completed successfully page for your records. Look it over to make sure your elections are recorded accurately. And then guess what? That's it. Once you enroll for your benefits, your elections will remain in effect for the rest of the calendar year. You have a chance to change your elections once a year during annual enrollment. Annual enrollment is typically held in November, and the elections you make will go into effect the following calendar year. Now, if you have a qualified life event during the year, which we mentioned earlier, you may be able to change your health care benefit elections right away. Now, a qualified life event includes getting married or divorced, the death of a covered family member, birth, adoption, or a change in custody of a dependent child, going on a leave of absence, you or someone in your family gains access or loses access to benefits because of a change in employment, and you or your spouse become eligible for Medicare. This slide shows the most common qualified life events, but it is not all inclusive. If in the future your health care coverage is affected by some event in your life, be sure to request a change on mytenet.com or contact the Benefits Solutions Center at 844-877-8591 within 31 days of that event. Well, guess what? That's about it. I know that we have covered a lot of information, but you need to know this. If you do have questions, feel free to contact the Tenet Benefits Support Center, which is open from 7 a.m. to 7 p.m. Central Standard Time weekdays. Feel free to contact them with your questions, or also go to mytenet.com or the Brookwood Baptist Health intranet site to view or print the benefits guides and rates. Thanks again for your time and attention, and I wish you all the very best of success here with Brookwood Baptist Health.